Hello, and my name is Dr. Golnar Raissi. I am right now in Stamford, Connecticut. I work in Tully Health Center. I'm part of the cystic fibrosis team of Columbia University Pediatrics. Um, and thank you very much for giving me this opportunity to talk about our entity by name of Bridge of Hope. So Bridge of Hope was established in 2011 as a not-for-profit entity, but it really became functional in 2012. So how the idea of this entity came, to be born basically was through our travels and the contacts that we had to different countries. We saw such a great need of helping patients with cystic fibrosis because their life expectancy was in such a low numbers, single digits, or even early teens, and versus in the United States that was, at least 3 times greater. There was no access to even basic standard of treatment, no diagnosis. So while this was happening, my husband attended a ground round at Columbia University. You know how they have weekly ground rounds. And it was very interesting that it was one of the law firms in New York City that was talking, one of the lawyers was talking about how to help patients with chronic illnesses globally. So after that conference and after traveling and talking to different people reaching out to us from different parts of the world, we decided, okay, it's about time to put an entity. And we talked to some families here, some families that they have kids with cystic fibrosis, and we had a meeting with them and we brought the idea, and everybody was so positive about this. And actually, one of the fathers, the father of this beautiful little girl, said, "Why don't you call it Bridge of Hope? Because it's really a bridge between U.S. and other countries." So Bridge of Hope was really, as I said, 2011, but then we started to bring patients from 2012. So when we put this together, right, so we created a website. So patients, they find us, they find our website, and they apply. So these are the patients from all over the world, and mostly from, I hate to say third world country, I always say limited resource, part of the world, which, they apply to our program. The countries are, for example, Georgia, Romania, Pakistan, Guatemala, Honduras, Peru, Trinidad, Lebanon, Tunisia, Algeria, Jordan, um, Brazil, Colombia, Iran. So these are the countries that patients have actually applied to our program, and we were able to bring them here for treatment. As I said, patients, they go online, they apply to our program, right? So when they apply to our program, our communication managers, they look at their application first. So it goes through them. And then the full medical history, the information about the patient, everything they've done gets to be asked. And they have to provide all of that. Then they send it to us. And what we do is we sit down and we review the medical history. If we see that, unfortunately, we cannot bring very sick children because we cannot do any lung transplant here, we cannot do any hospitalization, right? So that becomes really difficult. But then we try to select as fair as possible, I have to tell you, because we get a lot of applications, right? And then we give them a Zoom appointment. So I do a couple of Zoom appointments with them just to get to know the patient, review the medical history, and also to make sure that they understand our expectation, their expectation from us. It's kind of a vetting system too, right? But a lot of them, they don't speak English, so we have translator for them or translators that are trained in our program. And then if all that goes well, especially, the issue of being compliant, is very, very important for us and of course, for the patient too. Then they get accepted to the program. So they get a letter of acceptance. And then with that letter, and another letter goes with an appointment time, that is the letter that goes to the U.S. Embassy for the obtaining visa. If that letter is not accompanied with that, they will not get a visa to come here for a medical treatment. There are criterias in the application, right? But one of the important one is the child with one parent only, mom or dad. We cannot bring them both. So when they apply to the program, this gets explained to them fully. So the expectation is just a child and one parent, or if the kid is, older, maybe just the patient itself, right? So we help them with visa, as I said. If we have to write even more letters, we have done in the past for different embassies, US embassies around the globe. We've done that. They come here for a week of treatment. So when they come here, it's a lot of evaluation, education, treatment. So we follow the same protocol that we follow with our patients here, the US guideline for cystic fibrosis. We follow the same thing. We do the blood work, vitamins, sputum culture, chest X-ray, PFDs, spirometry. Um, and as I said, because it's a lot of education for families, most of these patients, they've never done a correct treatment, right? So it's a lot to explain in that week, in that whole week that we use. So basically, patients come every day to get familiar even with, what this disease is. Then after that, we usually give them a year worth of medication, which is all donated. I have to tell you, we give them the vest, the physical therapy vest machine. Again, we trained them, so it's a lot of hands-on and lot of education and time-consuming because Bridge of Hope. This is on top of our daily job, right? So time is the essence. But but I have to be honest with you that we have the best, most compassionate, caring, wonderful, optimistic, dedicated. I cannot tell you more about our volunteers, from our communication managers to the office staff to each individual that help us, in Bridge of Hope, really helping patients, helping, individuals with cystic fibrosis is their lifelong journey. Middle of the week, every day, middle of the night, weekends, weekdays, holidays. Our volunteers are there to answer, to facilitate, to help them. I mean, I cannot tell you more about our volunteers, that if it wasn't because of them, Bridge of Hope really could not survive. Um, so this is how it functions. And then they come to this country, when they come to this country for a week of treatment, then we have volunteers to bring them from the airport we provide the housing for them. It's a group of um, interfaith that we started from many years ago with them. It's called We Act of Wilton, Connecticut. So they help with housing. They help to provide meals for them. Then they bring them from I call it a cottage. There is a cottage that a good friend has dedicated that cottage to our program, so patients can stay there. They stay there for that whole week, and there are volunteers to bring them back and forth to our office in Stamford. So it's a lot of hands-on, but it's for a very worthy cause. So most of the patients don't have their genes, right? They don't know, the genotyping. So we do it, yes, we do it here too. And very rare, yeah, we had some patients from different countries that they knew their genes, they're older and they knew their genes. But then the question of modulators. So I have to tell you, the modulators, even we always ask for donation for modulators from, families that, if they miss, patients have missed one or two here and there, because even that one or two goes a long way for us because we combine it with an antibiotic, and then so the effect is prolonged. So we can use that. So even the parent, I mean, I have had patients that, they did not use three of the, for example, tricafters, right? Three pills. So they were asking, should we send it? And we were, yes, yes, even that three pills goes for 3 weeks for us. We bring them every year for follow-ups, right? We do every year follow-up, and we are in touch with them on virtually every month. And then WhatsApp number that, that our communication manager, she manages that with the patient. So we're in constant contact with the patient. And that's why, we always in need of donated medications. Even if you have, a couple of enzymes left in the bottle, as long as it's not expired, we even accept those because, as I said, a lot of patients. We started hoping to bring one patient per month, or so 12 patients per year, right? Right now we have 55 patients from different parts of the globe, and these were the patients, that used to be hospitalized a couple of times a year. And since they've been on the care of Bridge of Hope, they've hardly been, hospitalized. So because they're so compliant, and we always say we're not with you in your country, but we're only a phone call away or a Zoom away, right? I have to tell you, we had a younger from a country that she's the only patient that has survived in that country, that she's an adult now. This girl, the first thing she said after, after even 2 days of being here and following the correct protocol, she said, I can breathe. She was like, how's that possible? I can't breathe. And seriously, she was like, is everything okay with me? Am I okay? She couldn't believe that, after, 24 years, she was like, I can't really, she was very moved, and she was so worried because she couldn't believe that within two days that, she's breathing normally. Um, and that same girl, is doing so well. Again, she was hospitalized every couple of months. She hasn't been, hospitalized. Thank God for that. And I have to tell you, one thing that is so, so, so important with Bridge of Hope is really Bridge of Hope. It brings hope not only to individuals, families, siblings. Most of these patients from the countries that come here, the siblings, extended families, grandparents are very involved in their treatment, in their disease, right? So it's a hope for a whole village. It's not just for the patient. So hope of, education, career, maybe starting a family. These are the things that we take, that we're so grateful to have in this country right now. That, I mean, look, our patients are having kids, getting married, career, education, planning for future. So these are the things that you don't see globally. So these are things that Bridge of Hope is really touching, and we hope that we can continue with that. Yes, it will impact our program because there are countries that we will not be able to bring those patients, even they've been coming here for a couple of years. And no patient, I have to tell you, out of this 55 patients have ever overstayed, or they come for a week, they get the treatment, evaluation, follow-up, and goodbye. Because we pick them up and our volunteers drop them at the airport. So, but unfortunately, some of our patients that have been coming to us for the past 6, 7 years, they will not be able to come. Our lawyers have informed us they try, but there is no way we'll be able to bring patients. For example, we have a little beautiful girl from Libya. We will not be able to bring her. We have two young boys from Iran, we will not be able to bring them. And then other countries too. So that is really going to impact their health because, you know, they won't be able to get that medication or even that evaluation or the more, you know, as simple as, as simple as a spirometry. They won't be able to have it in their home country, just as simple as that. Or just the simple enzymes, just the enzymes. I have to tell you how many, for example, rectal prolapse we have seen because of lack of enzymes. Um, there are no enzymes in their country, or if they find it from, different parts of the world, they find, in a very low dose. And how can they even keep up with that, right? So as a result of this, I'm sure we're going to hear a lot of heartache, but we are so committed to our program, so we have to see where we can see these patients, outside America, because when you have a patient for 6, 7, 8 years, you can't just suddenly abandon them. I always say your patients become your family because we spend more time here than at home with our own family. And and I always bring that Eastern culture to my practice. I say, whatever I like to be done for my own self, my family, we would love to do it for our own patient too. So families have been so supportive so far with their medications. But seriously, this especially more than any time, we need medications. We need of course, financially, we are in desperate situation too. We need, financial help. And we are not for profit with tax ID number. So any donation can be, we usually receive, send a thank you note with, with the tax information and all that. Medication, again, any medication, any leftover that you have, even if you've used it, and you don't need to use half of the bottle or the full bottle or even couple of medication left in the bottle, as long as it's not expired, please send it to our Bridge of Hope. It really, really saves lives. It's not just, just you think that, okay, maybe these three medication, why should I even bother? No, no, no. It is saving lives of innocent children that it's not their fault that they were born in, in different parts of the world. And as as I always say, America, America is a country of hope. When these families come here, they come for they come for hope. They come for solution. They come for treatment of their children. So as we stand together, to help for patient to breathe better, let's really help our global patient and uh, and let's not kill that hope in them.